Welcome to the Fit Dads Podcast. I'm Brad Thompson. I'm joined as always by Ryan Dutton. And today we've got joining us TikTok's very own professional feeler of muscles, George Leveland.
Hiya.
How are you, mate?
Yeah, I'm good.
Good.
Yeah.
Thank you for joining us, mate.
Thank you.
Thank you. Mate, honestly, I'm buzzing to have you on. Kick us off, mate. Introduce yourself. What do you do?
Yeah, so I'm George. I am a physio, or recently a physio. Been doing sports massage mainly for the past couple of years, delving more into the physio stuff. And yeah, base at Station Gym, really good, really enjoying it. It's been a different change to what I've done previously. So I used to be in the military, was in the RAF for 9 years, took a total change in career, and now I'm here. So yeah, it's good.
What made that change of career from...
So it's a really, not even a particularly good story. I didn't enjoy the military anymore. They were going to pay for a degree. I was like, what degree do I fancy? Physio was the one.
Cool.
And yeah, so it was a big plus. And fortunately, in the aviation world, there's a fair few jobs outside of that I could have just used as a backup to go into. So that's kind of where I sat with things. However, doing physio, doing sports massage, all the hands-on work, love it. So it's really rewarding.
Why the military? What made you go down that route?
It sounds like a bit tight here. So when I left college, I didn't want the university debt.
Okay.
And I was like, I don't really know what I want to do. I was like, let's just try the military again.
Amazing.
And it was good. It was really good. It was an experience. Definitely grew a lot. Changed better. I think I probably could have gone down some weird paths. So I'm from Lincolnshire originally, in the middle of nowhere.
You sound posh.
Do I?
Posher than our usual guests.
You're like a more polished version of me,
Yeah.
which I like.
Just Brad in every way. Looks like him, gets mistaken for him.
Yeah.
I mean, I mainly get mistaken for George. Yeah.
Same height.
I just get heckled like out of the gym saying, "George, fix my back."
I know, yeah.
Like,
It's from behind. We've just got the same head.
probably, yeah. The same
I've
profile.
never actually noticed, but yeah, you're
No.
probably right. Yeah,
Yeah.
very similar haircut.
That's the only
Yeah.
reason why I've grown a shit goatee beard, to be honest.
The thing is, if I was to grow it out, it'd be exactly the same. There's
Damn
nothing
it.
else otherwise.
When I was follically challenged around here.
Yeah.
Damn Norwegian genetics, aren't they? Damn it.
Better be follically challenged up there. Proper dad life podcast.
Honestly, which, I mean, in terms of the military, I've spoke to you loads about this, George. Like, I've got loads of mates in the military. I sort of understand that life. Resonate a lot with what you said about not wanting maybe the student debt, if you know what I mean.
Yeah.
I suppose transitioning into what you do right now, what is it that you most enjoy about the physio world, or...
Yeah. So when I first did it, I kind of only understood NHS route, and I was like, that's probably what I'm going to end up going down. So they kind of do a lot of hands-off assessment, exercise, that sort of route, whereas I've really gone down the route of it's a lot of hands-on. Within the sessions that someone comes to, I want to do as much hands-on as possible, because when it comes to exercise, you obviously can tweak techniques and things like that. But actually, what I want to do is make a change within that session, and that's my main aim. I almost feel guilty sometimes if someone comes in and I've not got the change I wanted. They obviously don't know the expectations of what they're going to get, but for me, I'm like, oh God, that wasn't a good session. And to be fair, yesterday was a bit like that for me. I had some sessions where I was like, oh, I don't know where I'm sitting here with things, and I wish I got better results. But that kind of drives me a little bit to look at different techniques all the time and improve that way. So it's good.
Do you mind me asking about... I think I spoke to you about this separately, about hands-off versus hands-on.
Yeah, hands-on,
What's the sort of differentiation between that?
Kind of mentioned hands-off, where you do an assessment, so you're hands-on a little bit, but you're really kind of just seeing what movement patterns there are, what isn't correct, what is correct, and then you'll be like, okay, so let's do some exercises for that. And it doesn't tend to be gym-based, that's the other issue. It tends to be banded work or body weight, which has its place. However, kind of for a lot of people I see, they're gym goers, they're overtraining if anything. So if you strip them back to that sort of stuff, that's not good. Whereas for the hands-on stuff, I'd say 80% of what I see are usually tendon issues from overuse and people training too hard and not actually understanding recovery enough. So when you're doing the hands-on stuff, most of the time what I'm trying to do is relieve tendons off and loosen muscles down, and ultimately get rid of pain. And you can do that through breathing techniques, you can do that through needles, which I use on people, and they mixed reviews. Mixed reviews.
Why do people have mixed reviews? Obviously it's known as acupuncture, right?
Yeah.
Why? What's the hesitation around that?
It's a strange one, because a lot of people, for whatever reason, have different phobias with needles and things like that. However, when I'm using them, I'll show them the needles and they're really small, and then I'll use it and they're like super apprehensive, hating it. You put it in and they're like, oh, it's not as bad as I think it was. So I think it's that initial thing of like, oh, it's really going to hurt, it's really going to hurt. And then actually when you do it, it's not too bad. Don't get me wrong, sometimes you get reactions and the muscle reacts, the nerve reacts, and it goes crazy and they're almost jumping off the bed.
Okay.
But that's really rare to happen. But for me, it's really good using them needles because to release muscles, usually you have to apply a lot of pressure, whereas when I put the needle in, it's in, out, done, and I can move on speed. I can get a lot done within the session.
Cool.
Yeah, it's cool.
Apart from that maybe being wizardry, how does that work? Because when I was talking to you about it, you explained it really, really well to me. To confirm, George, last time I had a treatment with you, you went in my tricep and you're like, have you ever had any treatment done on your tricep? I'm like, absolutely not. It's like, right, I'll try some needles. My tricep went crazy. It felt like an instant release. And I'm like, what is this? How does this even work?
So for me, when it comes to tightness within muscles, you have the connective tissue, you have the actual muscle itself, and you have the nerve. A lot of times they can all play against each other. And the worst is when that nerve is just holding on to everything. And that nerve will just not let that muscle let go. And you'll feel it in consistency of muscles. Like you'll feel it on yourself. If there's a super hard muscle and it doesn't matter how much you press and it hurts, it just won't let go. Unless you put a lot of force in, which people don't enjoy. So as soon as you put that needle in, it reacts with the muscle, goes from a shortened state to a long state quite quickly, and then the nerve reacts and goes crazy sometimes. And then as soon as you've done that, it's instant relief, and everyone's like, wow, that feels so much better. I had one lady a few weeks ago, and she was super apprehensive about the needles. I did the needle. She had a bit of a meltdown. We had to sit her down, go through a bit of breathing techniques and things.
Was she phobic of needles?
Yeah, she wasn't 100% with them, but I was like, honestly, we need to do this because she'd had pain for like 10 years within a lat and subscap and lots of issues. We did this one needle, got the release I wanted straight away, which I was super thankful for because it's into the lat and sometimes trying to get the exact point can be a bit tricky sometimes to get it 100% right.
Is that because it's such a big muscle?
Just a big muscle, and when you're feeling it, there's loads of different trigger points and kind of was working out, I was like, that feels like the biggest one, so we'll go for that. Got it. After she sort of relaxed out, then she was like, oh my god, I feel so much better. Bring her arm up and down. She was like, I've not felt this relief in ages. And it was all just from one point in there. Again, the nerve holding into there, so you've got like long thoracic nerve holding in between that lat and serratus, and causing lots of issues when it comes to shoulder mobility. So it's really interesting. And like I say, the hands-on stuff, I've just found it enables people to get a bit more range, less pain, and then when it comes to their training and doing rehab, they can either just go kind of straight back into what they were doing, or they're at a better path to be able to rehab themselves better, which is cool.
One thing that I want to ask is, I think people have like a go-to guy they go to, right?
Yeah, 100%.
I definitely do. Tom's my go-to man, and I send a lot of my clients to him. But I'm worried that I and a lot of people fall into that trap of having one person for every issue.
Yeah.
Do you know what I mean?
Yeah.
So you might, I see it a lot with chiropractors. So they'll have like an issue, really sore and painful. And I'm like, oh, it probably needs a good either sports massage or some physiotherapy to get some exercises to get out of this.
Yeah.
And like, no, it's okay. I'm going to go to my chiropractor guy and he's going to pop a few things and make me feel better.
Yeah.
Now, the chiropractic industry itself is a little bit sketchy, as we know.
Yeah.
But I think there's an issue with people going to the same person for a lot of issues.
Yeah.
How would you kind of clarify what certain people need to see for certain issues? If someone's got like, I don't know, back tendon issues, if they've got muscular issues, if there's tight nerves, do you have different tools in the toolbox for that? And I guess what I'm trying to get at is, can you clarify who needs to be seen for what issues?
Yeah. Ultimately, that is a super difficult question, because if you kind of look into actually treatments with people, a lot of the time is actually like psychological. Mm-hmm. So I've had certain people where we've not even done too much treatment, you're just chatting to them and they start to feel better because they've almost released off whatever tension they're feeling. Yeah. So there's a lot of factors with that. Yeah, when you come into specific injuries, I tend to think anything soft tissue related, you're looking good at someone that's decent at sports massage and like the physio stuff, but then at the same time, kind of your osteos, your chiros, if they're doing soft tissue work and manipulations and they're using kind of a collective package rather than just right, we'll just click, 7 minutes, boom, on your way, it's probably not the best approach. Whereas if they're doing multiple things and actually analysing what's happening in front, that's good, because there's a lot of things as well where if you're coming in with an injury, that person who's treating you is already thinking, right, what is it going to be? And you're thinking of patterns of what you've seen before. And sometimes what happens is you're like, right, it's definitely this. And you're like, yeah. And you're not really listening to what they're saying because you're like, right, I'm just going to treat this. Then when you come to do that, you're like, it wasn't that. And then you have to revert back to actually what they were saying and listening.
Okay.
I hate using the word, but it's like that holistic package of seeing that. But again, everyone in their own right, therapist, even massage, like everyone, if they're on it with everything, you can treat a lot of things.
Okay.
But there is a big psychological element to a lot of it, especially when it comes to like your lower back pains, your chronic pains. Because actually, when you chronic pains, there's no tissues that are potentially damaged at that point. It's all just from your brain being like, I don't think that's right.
I guess it highlights the importance of someone being a good people person, in your career, someone who can ask the right questions and just understand their issues and whether they are physical or mental. A lot of people, I was speaking to you just before the podcast, and we had a lady recently who came on and was doing everything that I asked her to do, but she just wasn't losing any weight. And the root cause of it was just mental stress. She had so much going on personal-wise, financial-wise, and she was really wanting something that wasn't there because she was so mentally stressed. And it's hard to accept that sometimes for the coach and the client because we all want the results. But unfortunately, it's just not the right time. I guess that's why someone like you can come in and just start to relax them physically and mentally, make them feel better.
There's definitely a big like de-stressing element to all the stuff that's done when it's hands-on. I've had a few clients where they've come in for, it's usually like back, neck and shoulders are just sore and stiff, and you'll loosen them up and they'll feel really good. But how long that's going to last just depends on them. Like I say, I had a guy yesterday and he messaged me this morning and he was like, mate, I'm still not good. And after the session, he was like, I feel incredible. So now we're going to have to look at different factors of, okay, what you're doing at home, what you're doing at work, what's actually affecting you that's making all these pains be an issue. And I think sometimes, even though like physio and movement and hands-on stuff is the way, you actually need to like really strip it back to see what is actually affecting that person. And it kind of crosses over to PT as well. Making sure, like you say, they're all good that way.
I think that's what fascinates me. Sorry to cut you off, Ryan. Like what you just mentioned there about almost not wanting people to come and see you again, respectfully. It's a bit like, if you can fix them, cool. Tell your friends, let me fix more people. Great. I suppose me and Ryan probably have a really good understanding of what it takes to be a good PT, a good coach. How would you advise people to maybe spot maybe a bad practitioner in your space? I appreciate that's quite loaded and you don't have to throw anyone under the bus, but
this person, no. I think if you're seeing someone regularly and they're, prior to even doing any work, they're like, right, you need 10 sessions and this is the package we're going to go on. Don't get me wrong, the package things are good, but if they're kind of doing it by, say, 10 sessions, you're probably looking at, they're going to drag it out for them 10 sessions, or they're just not the right fit for you. And the same kind of with the monthly retainers. Don't get me wrong, I have a few people that are on monthly retainers because it's kind of required. But I think if you're promoting that monthly retainer for injuries anyway, I don't think that's the correct fit. And there'll probably be people out there and they're like, no, that's totally wrong. And there are differences to that. But I think on the whole, if you're trying to lock someone into pay your mortgage, it's not the right fit. I don't think they've not got your best interests at heart to be like, right, okay, I actually think we'll do one more session this time, we'll see where we're at and we can adapt the plan. And that's what I like to do. I like to get someone in, we'll see kind of where they fit and they've recovered after that week, and then we'll make a plan go from there. And I'm like, right, so we can do this next week and we should get you to here, and then we'll keep spreading it out. The best example I've got that is I've had a lady and I've not seen her in months, which is great. And initially we did quite a few sessions and then we've spread it out, and now I don't know where she is, which is cool. That's how I like to work. And I think that should be promoted more, to not have someone rely on a therapist to make you feel normal.
I agree with that.
That's one of my key staples I say to clients, even in the consultation. Like my role is that you're not going to need me in future. That is the entire point. So what do you need to know to not need me anymore? I suppose it's different with you because it's so hands-on. Who would you say is maybe a good person to maybe come to you every month? So I think I've got an idea of an archetype of a person in my head, but is there anyone who you commonly see every month and you go, do you know what, you're going to really benefit from this once a month?
So I guess my main monthly retainers are like runners. They just smash themselves to the ground. However, they've only got their legs that they can do that for, so they need to get loosened up and things like that. Whereas gym goers, yes and no. I find people in the gym, they'll train around tightness or they'll train around injuries, and you can get away with it a little bit more because you can like deload that muscle group for so long until it feels a little bit normal. So I find people that are super active. The other group that don't probably do it the most, and they should, are kind of labouring jobs. So they're doing labouring things, and then they go into the gym, and then their elbows are shot, their hands are shot, and they're like, I don't know why I've got this pain. It's like, you just got tendon galore shouting at you because you're just overusing them. And the kind of like office workers, sometimes I feel like if you can do little things each day with regards to like an office job where you're in this posture, you can stay away from a massage therapist unless you enjoy it. You know what I mean? That's a different thing.
Interesting. Yeah, I'm glad you've covered all those things because everyone fits into a different category there. And I've definitely done more reading. We spoke about that on the podcast recently, and it is just using the same set of muscles over and over, and everyone has that little area of tightness that they tend to find, whether it's IT band, calves, hips. And we do sometimes just push through it a little bit, but you can only do that for so long, can't you, before you need to kind of get that release. I did the Sheffield Half Marathon recently, and my calves have never really been an issue, but they just haven't recovered. I've stretched them, I've tried to give them my own little massage, because they're quite easy, your calves, you can kind of get in there by yourself. But they're just not doing it. So I think that's when you need to see someone and just get that tension released, because when it's just not going by yourself, that second person coming in and giving you a once over can be invaluable.
Definitely. Yeah, and like I said with your calves, it sometimes links to that nervous system. So for yourself, you had a big event, and then what's happening is that sciatic nerve probably for yourself has been under a lot of force. So your calves are just being that point, they're just not going to let him go right now.
Super tense. Walty wanting to get his strokes and cuddles in.
That wasn't me, by the way. That little wince.
I thought you were letting something off there.
Pump it first time, mate. Have you got do you see any commonalities in people? Like, is there any common sites of injury or any common, I don't know, problems that you see that you go, do you know what? In an ideal world, don't want to be doing as many of these.
I wouldn't say we've not seeing as many people, because I enjoy it regardless. And even though people have the same sort of injuries, they are like a bit different. But it's your classics: your lower back, your shoulders, your necks. Shoulders and necks kind of link each other a little bit because nerves and just muscle groups that are around there. And what I find with the legs are, knees, I guess. But when you're looking at knees, you're looking above and below, and it's never actually the site of injury that tends to be the issue. It's elsewhere. How I tend to work is a lot of postural stuff. So if I'm looking at the posture and the posture's out, that tends to be kind of where I'll aim things. But if I was going to say most, probably shoulders, for the fact of people having pains or even just like overtraining. I think overtraining is the biggest one I see. Getting pain here. You've got like 8 tendons that run through here from different muscle groups. So when people are getting pain, they're struggling to here, they're struggling out here, and they're getting lots of pain in there. And it's working out what muscles need releasing.
Everything goes through your shoulders, doesn't it? Even not just your pressing movements in front, overhead, but when you train your back, you're getting a rotation through that shoulder joint. So
I suppose it fascinates me how many muscles actually attach to that scap as well, like the scapula. There's a mind-bending amount of muscles that actually attach to there. They're so complex, shoulders. If someone is maybe wanting healthy shoulders, have you got any tips for them in terms of, okay, apart from the overtraining aspect, is there anything that you'd recommend aftercare wise if someone is struggling?
So with shoulders, what I find the biggest factor is lats. So you've got such a big muscle on the back, and when it's tight, because it attaches into here, it rotates that shoulder forward, and that's probably the biggest issue I see. So when people are sat on their desk all day, they're in this position, the table's a bit high for me.
It's not really these fancy ones that raise stuff.
I mean, I would say you absolutely wrecked my lats. I definitely needed it. I've started doing more pull-ups and stuff, and I remember as soon as you touched my lats, you were like, yeah, man, we need to get rid of this. This horrible tension.
And as soon as you do, like, everyone's posture ends up they're like this. They're like, oh, I feel so much taller. And it's just because everyone's just so in this posture.
Internally rotated.
And just from phones, and everyone does it. It's one of the things. But it's like simple things you can do with P&F stretching against the wall. So where you're pressing against it, you're pushing down, and you're using that wall to kind of aid yourself to open yourself up. That's That's really good. That's probably my go-to. It's just really like simple things, even just doing like a minute a day on a certain exercise. And like from exercise point of view, like Google's your best friend. There's so many out there. Everyone's so different to what's good for them. So a simple Google search, AI search, just see what's good and just adapt from there.
I think one of the biggest issues is people just get caught doing, I mean, we're all guilty, but we get caught doing the same exercises for years and years and years. And the amount of people that come to me and say, yeah, I've been training for 2-3 years pretty consistently now. And you have a look at the program and they've not changed anything. Nothing in like 3 years. And just that same front raise, that same forward press. Not even any variation of it. No different pieces of kit, not on a cable machine. It's just all dumbbell work. And that over time is just a nightmare. Our bodies they're not conditioned to do those same movements so repetitively. No. But if you look at in the gym, people like what they like. They like a certain piece of kit. They know it's worked in the past, and they'll just stick with that, hammer it until something goes pop, basically. Big issue we see with the people that I work with, for sure.
Yeah,
definitely. I suppose one thing we've not touched on so far, which I did briefly say in the intro, TikTok's very own. I love those videos where you sort of see that release.
Yeah.
How are you finding life on TikTok?
Yeah, well, I think that's what has catapulted my business. So I think with TikTok, I've been consistent with it since last year in April time. So yeah, pretty much a year. And
why TikTok over anything else? Because I guess it's probably, I think of it as being a bit of a younger generation.
Yeah.
How old are you, George?
31.
Okay, so you're not like...
Not a spring chicken.
No. Your words, not mine. You're a dad now, mate. We're not spring chickens.
No, it's all downhill.
But I always think Instagram's more of a bigger pull for a lot of people, isn't it? But I guess the younger generation now are really seeing more of TikTok.
I think you'll be surprised how many older people are on TikTok. Okay. I'd say from the people I've seen, I'm looking at like 30, 40s from TikTok.
That's interesting.
Yeah. And to choose that platform. So for me, as a person, I feel like I'm not super polished. Like I've not got that Instagram video in me to consistently do every day. And I saw the appeal of TikTok of it's kind of just raw footage. I can record what I'm doing, post it up. If it does well, it does well. And I don't know, I think I saw a video actually, and it said, if you post once a day on TikTok for the next year, it'll change your life. And I was like, I'll try it.
Okay.
And kind of.
So do you post every day?
So I did. Kind of the past 2 months I've been slacking a little bit. But yeah, from kind of April to September, I was super consistent once a day. And then on September, whatever date it was, I hit like a pretty crazy video with regards to like views and likes and things. I think that video sits at like 15 million views now, which is just like insane.
Wow.
And from that video, it made all my other videos do well.
Of course.
And then kind of me being me, I was like, right, every video's doing well now, so I'm going to post like 2-3 times a day. And I did that from September until about Christmas time, because that's where I burnt myself out a little bit.
Right.
And from there, just things went nuts. Pretty much every referral I was getting from TikTok, I had people travel from Manchester, Birmingham, Leeds, everywhere to come see me. And it was all through these like needle videos, because everyone kind of had that thing of like, I've got tension, it feels really deep. I've had massages, it just doesn't seem like it gets to it. And kind of the needles show when it goes into that muscle, you get that release, and it's really cool. And
it's very visual, isn't it? When people can see it happening in person, that responds. It always responds well with them.
I'm always keen to like bring up a topic that I can see someone spring into life. And admittedly, I was quite hesitant to bring up TikTok, so I don't want to like label you as like the TikTok physio. But I've just seen probably how it's, again, change your life, change your business. And it's amazing to see, because I regularly speak to people in reception at station. I'm like, oh, you'd see George today? Yeah, he's great. Where have you travelled from? Like Manchester, Birmingham. And I'm like, this is mad. Like, and I can 100% say you're worth it, because you clearly know your stuff. Where do you see, I suppose, the future of TikTok? I know is it shut down now in America?
No, it's okay.
Okay, that's fine.
It did for about 24 hours.
And Trump sorted out. It's all right.
Like he gets to mention every podcast. Trump, doesn't it? But
I've got a suspicion that was intentional, I think it was all planned. I mean, it depends how conspiratorial you want to get, but I think, because it wasn't long after he came in, was it, that happened?
Yeah.
And I think there was something where it shut down, everyone got like, you know, up in awe about it. Because how many people spend their lives on TikTok? I can't remember how many businesses thrive on TikTok, and actually that's their main source of marketing.
Yeah.
Then he comes in, big knight in shining armour. I've saved it, guys. Don't worry. I'm sure there was something behind that. There must have been.
No, definitely. Yeah. I'm the same as you. Tinfoil hat on all the time.
Yeah, I'm a little bit. Yeah.
Did you consider messaging him?
Yeah,
Like, come
I
on.
did. Yeah.
That's why I
no
got
worries,
back in. Oh, I love that, mate. If you don't mind, I thought I'd introduce a little segment for George, which is what would George say?
Oh wow.
Right?
Okay.
So I've put here, what would George say to people who? All right. So I've got question number 1. To people who think physiotherapists only do massage.
Yeah. I think that's. I think there's two divides with it. I think NHS, they think they're not very good, which is bad, because there's a lot of really good physios out there. They just don't have enough time. And then when it comes to private, it's like massage. Right, I'm coming for my session. Like, fix me within an hour, half an hour, whatever the session time is. It's like, right, that's not how it works.
You mentioned about fixing people. Have you got like your favourite success story? Someone who's, I'm gonna say whose life's been changed, because again, I've seen some awesome coaches, some awesome sports therapists and physios, and it can be life changing.
I've got 2 that come to mind, to be fair. So there's one that's an old lady. I think she's in her 70s, something like that. When she first came to me, she came and she got a little walker. She wasn't walking very well, and I saw her 3 weeks ago, and we've now got her like bodyweight squatting, like moving really well. Like, when she comes in now, she's almost like skipping. She skips out the room. She's loving life. It's amazing. And prior to that, she'd seen loads of different people, and for whatever reason, my sort of style and stuff is helping her a lot. I think a lot of it as well, just to kind of touch on a little bit, is like the positivity. So that regardless of what people say to me, I always just try and spin it in a positive way, because for me that psychological thing is such a big factor. And if you can be positive about someone's injury, even though they've had a horrendous time, I think it gives that extra edge. Even though I'm not doing anything different, I'm just being like, okay, that's fine, you're not broken, like we will fix you in some shape or form. So that's what I like to add to my sessions a little bit. And then the other one is kind of needle based. So I had a lady, and she suffered from migraines for about 12 years. And we did one session with her. She got some improvements on these migraines. And then after about 3 sessions, she had a stint where she had like 30 odd days with no migraines. And she got back to doing yoga, which she wanted to do. She got back to doing these long walks, and she was like loving life. And she's reverted back a little bit now because of other factors, but it's basically enabled her to find her triggers of where these migraines are coming from. And she's like, oh, right, this is what triggers my migraines. Whereas before she didn't have that, which is cool. So even though she's not fully there yet, but she's on the path, and she knows that there's a way of changing things, which is cool. But there's loads of
I never even considered that the body and the tension in the body might be affecting what's happening with headaches, migraines, and tension in the brain, essentially. That's fascinating.
And it's funny you should say it, because I saw a post earlier from Joe DeFranco, and he was talking about he came away from barbell shrugs because they were literally giving him headaches and migraines. So it goes to show how all that's interlinked, which is unbelievable.
And the most thing with headaches as well, so a really common pattern when you've got an injured shoulder is round and forwards. It's called like a capsular pattern. And as soon as you do that, it puts these muscles on tension, and obviously you've got loads of nerves that run through into here. So when this is really tight, you get nerve compression. People get pins and needles down their hands and things. I've had 2 people actually in the past couple of weeks saying pins and needles down their hands, and it's all coming from this area. So it's really interesting, like when you step back and look, okay, it's not just this hand issue here. We're looking at coming all the way from the neck, and it's really cool. It's interesting. I think that's why I love it. It's just I don't know, so fascinating.
It's cool. Absolutely. And every case is different. Everyone's just slightly different in terms of their posture and what they're struggling with, and what they've got going on mentally in their personal lives. And it's funny, isn't it? I mean, we can relate to this, but you do sometimes take on a little bit of that as well. You know, when you're dealing with certain people and they're telling you their issues, you become a little bit of an agony aunt, which is a good thing because it's helping them release tension. But it also can be quite bearing on you to a certain degree. Do you find that with your job, like when people talk to you and they're just overwhelming you with like their issues from the moment you walk into work to the moment you leave? Do you tend to find that affects you a little bit?
I'd say so, people just open up to me. Like, they'll just tell me, I don't know. just all these personal details. I'm like, you don't need to tell me that's a bit too much.
I suppose it's it's a physical job, isn't it? Like, as silly as it sounds, and I might be going a bit pseudo with this, but that physical contact sometimes can actually bring people's barriers down, I imagine.
Yeah. And so I've not had it, but I've heard of experiences and seen people talk about these experiences where if you can let someone's pain go in certain areas or stress go, they almost have like a really emotional response and just cry, and it's like they let go. Which is interesting. I hope I don't see it in my time, but it'd be cool to see like if you can get that release with someone.
Wait till that next session, mate. Wait for that. As soon as you touch my hamstrings, that's it.
Wait to get Brad talking about his issues. No, but I've always said that some of the most productive sessions I've had with clients, we've lifted no weights. We've literally just talked sometimes, and that's what they need in that moment, for that hour. They just needed someone to vent to. And it's amazing how that improves the rest of their week. And I'd much rather a client, if they've got loads on their plate, just sit down with me, talk to me, let me know what's going on. I'm not asking everyone to open up and tell me the gory details of their life, but if they've got something they're thinking about and they have no one else to talk to about this stuff, if it means that it's going to make you get to the gym in the next few days, let's vent. Let's just get it out in the open. And you do sometimes become a little bit of a counsellor to certain people. Not everyone, and it can be a bit rare on occasions where it gets quite as personal as that, but you need to be able to help. You need to be, I think the best coaches, I've always said, are an amazing people person, because they're able to get to the root issue of what someone needs on a physical and mental level.
And to be fair, I think the crossover for coaches and PTs, like that is probably an aspect that should be covered a lot more, and it probably isn't. I don't know what the sort of like training is with that, but there is a big emotional factor with when you're someone's like coach or therapist. Or
there's like a small modules, but again, it's the PT qualification is over a few weekends, isn't it? It's never going to be able to cover everything in detail. But it's just something you learn very quickly as soon as you start coaching. People have a lot going on, and then you start asking more questions and pinpointing exactly where their issues are. And it's like, well, why do you want to lose weight? Oh, it's because of X, Y, and Z. I'll do it for and they're not doing it for them. Usually they're doing it to like get back at someone, or they're doing it to be better than someone, or it's for the wrong reasons. And then you need to ask yourself, well, what do you really want? Do you want to be healthy? Do you want to be happy? Okay, well, what's going to get you to that? Because it's probably not losing a few pounds. It's probably seeing a counsellor. It's probably talking about these issues and this trauma that you've got going on. And you get it a lot with girls now who want like big bums. Like, I want a really big bum. Well, why do you want a big bum? Because everyone on TikTok's got a big bum. It's like, well, that's just not reality. And you never know what's going on behind the scenes and what they're doing and the funny surgeries people are getting nowadays. There's always a reason why someone wants to change. And I think getting to the root of that at the start of someone's program is so important.
100%. And to go back to the big bum thing, what keeps happening is people they're getting knee problems because they're getting pulled that much by their strong glutes, and the front just can't handle it.
Oh, really?
Yeah.
So there's a repercussion to having a big bum nowadays.
A little bit, because it depends. If it's nice and strong and supple, then it's fine, but if you've got some tightness within there, that's what causes
they call it the diaper butt nowadays, don't they? The diaper butt is where you get surgery and you get fat injected into your bum. And I think it was a Kim Kardashian photo that came out years ago, and it was basically her on the beach, and these rogue Mexican photographers had taken this photo of her. Because normally every photo that gets released is by her, her team, her own photographers, it's professionally edited. But they got this rogue photo of her, and it looked horrendous. Because if you train your glutes, as we all know, you have to train your quads, you have to train your hamstrings. Those things by nature will work in unison, and it all look pretty in sync. Whereas if you just inject loads of fat in there, you've got these little skinny chicken legs with this huge bum at the back, and that's hence the name diaper butt, because it looks like you've got a diaper on. And it wasn't great. I've seen the photo. Amy showed me, actually. It was fascinating. Not that I'm Googling Kim Kardashian. But Amy had come with that. What do you think? I was like, that is the most... It was wild. I've been looking at it for like 10 minutes going, that is wild. Like, it just doesn't even look real. It looks so fake. But that's the look nowadays, isn't it? And that comes with a cost. And I can imagine that then is even worse, because now you've not got the legs to support it, you've not got the infrastructure underneath those glutes, and the joints start taking it. I bet you get hip issues, knee issues, even ankle issues, because of that kind of change in weight distribution.
Just for a certain look. Because I think the thing that I've seen a lot recently is I don't know, when you're sort of younger and in your 20s up to your 30s, you're either wanting to look better, be stronger, more powerful. But then I'm finding as people getting older, the kind of term like longevity's coming in a bit. And people are like, they don't want to be as big. They want to be kind of more slim and athletic and feel good that way.
I think there's a bigger push on like performance now as well. I've seen that in everything I do from people. I just want to do a half marathon. I want to do a high rocks. I want to go and do this fitness competition. Like there's more of a pull on like it's more than just looking good now. It's like I want to perform well. And that comes with, you know, a certain sense of looking after your body even further. Because to look good, you can kind of get around a few things, and when you're running every week and you're trying to hit certain numbers and be athletic and hit certain levels of performance, I think someone like you comes into play even more. I really do.
I feel like I've shared this story once or twice on the podcast before, but one of my biggest success stories was training someone who had just done bodybuilding type training, and then we got on moving, dare I say, functionally, or just getting the movement patterns nailed in there. And I think it was Bronte who said sugar muscles. He was basically sugar muscle man. He had no functionality in his body whatsoever. And then all of a sudden we built these movement patterns on, and genuinely never looked as good, never felt as good, no pain. So I suppose linking that into movement quality, performance side of things. And I've said it before and I'll say it again. I feel like Kardashians have ruined the world. I mean, it stresses me out, man.
You even see it from like a face point of view, like a makeup point of view. How many girls, when you go out now, just look like carbon copies of the Kardashians? It is fascinating, isn't it? But also, wild to think they have that much influence, that much influence over the way people look every day. Like they like, everyone wants their look. And Amy's still completely obsessed with it, and she had it on the day I come in, and there was one. Well, I'm going to sound really nasty here, but there was one of the like Kardashians that was like the ugly sister.
Which one's that name?
I don't know what the names are. I know Kim, but I don't know what the ones are. Is it Courtney or something like that? But there was one, I can't remember. There was one that was like a bit of an ugly duckling in the family, let's say. And now she looks even better than all the rest. And that's just from like obviously surgeries and makeup and things like that. Like, wow, you can literally change who you are. So I just pulled up a story in my mind of a guy in China who sued his wife because when they had kids, she'd had that much surgery that she didn't look anything like what she was supposed to look like, and the kid was like quote unquote ugly. So he sued his wife.
No way.
Believe it or not, and won. This is a case in China. Wow. So the guy had he had a child with this woman who was beautiful, but she'd had loads of surgery. And when the kid came out, it looked nothing like them both. And then he forced her to show like pictures of when she was a kid. And obviously it wasn't to his taste. He was like, wow. I didn't want this. Wow. I mean, the fascinating that case even went to court, and fascinating that he even won. That I don't think over here that would even be
the catfish kid.
That's what he'll be known as, the catfish kid.
What a horrible reputation.
I thought that was fascinating, but it also does show that like stuff like that is happening. So like 100%. You can get that now, where if you know everyone wants to look quote unquote attractive. But if you look for that kind of too much, and you get with a partner, and later down the line when you take your makeup off in bed, all these sketchy kind of.
What would you say, George, if you had Kardashian level influence? What message would you give to the world if you if you had that? This is quite a deep question.
That's a big.
It's a big question. George hates glutes. George hates big bums.
I guess message wise, actually, with regards to like pain as such, I think the thing I see the most is with like overtraining, and when people get these pains, they just like keep training through, and then they're like, oh, they'll be fine, until they're absolutely broken. And it's like, why get to that point? Actually, prioritize recovery. I think that's the best thing to think. If recovery is probably more important than training sometimes, and I think that's really over missed. So that's my Kardashian message. Recovery
message, because that is one of the what would George say questions for me. In terms
I think the big issue there is a lot of people sometimes find it hard to differentiate between what's pain from a bad point of view and pain from a good point of view. And it's just like no pain, no gain. And it's like everyone thinks if I go to the gym, I've got to experience pain. They will just kind of flag it off as it's just a little bit the aches and pains of building and growing. When actually there comes a point when it's going to be debilitating.
I guess the best way to think about it sometimes is, so for example, if we're doing your bicep, you get DOMS in your bicep for like 2 days, your tendon kind of takes 4 days to recover. However, people don't really know that. So then they'll keep training, and like on the 3rd or 4th day, they'll do biceps again. They'll get DOMs in their muscles for 2 days, and then the tendon hasn't recovered. However, your tendon doesn't tell you that until it's kind of like too late. So you'll get your tendon, it's like a bit of frayed rope, and you're fraying it and you're fraying it until, unfortunately, it's too frayed and then you start getting pain. However, what happens with the tendon again is you'll start training and you're like, oh, it felt a bit painful, but it's eased up again, and like, oh, it feels good. And they'll train, and then they'll get pain kind of like a few hours after, or even the next day, and they're like, oh, well, if I just keep training, it'll go away. And then they're just fraying that bit of rope, and then they've got a really serious injury, and then they just don't understand that. So that's what I see the most.
Do you think the lack of recoverability from a tendon is down to like blood flow? That's how I imagine it. Because if you're training a muscle, you're getting constant blood flow. It's bringing in good stuff, taking out the bad. I imagine, from what I know, that tendons and ligaments are a little bit tougher for blood flow.
That's exactly it.
Does sports therapy, physio, would you say that really helps with it?
I think with regards to the physio, the physio is the kind of the training element. So that's where, like, your program, it needs to be solid, and you need to basically do movements that aren't going to flare that tendon up anymore. And it's actually, when you're doing a program, you need to be thinking initially like your prehab, rehab, like that's where you need to start, and then progress from there. The massage side of it and the hands-on
he's determined to get strokes today.
Is where you can release the tendon a little bit, because what happens when that tendon gets kind of sore and aggy is the muscle will end up being get quite tight. So if you can release it down that muscle, it will give that tendon a bit more space and relieve pain ever so slightly. So you can kind of artificially do it, and it depends how bad your tendon is to if that actually gets relief for a long time or not. But yeah, the recovery element, and I think the programming of things is one thing, and that's one thing that I found with PTs in some respect is probably don't understand the recovery side of it enough, and I get people in and they're absolutely beaten up, and then I'll be saying one thing and they're like, oh, but I'm paying my PT, and they're saying this, and then they'll just keep doing what the PT says, and then they just keep getting worse and worse, and they're like, well, I'm doing these sessions with George, but it's not getting any better, and I'm like, well, you're not listening to what I'm saying at all. So that's a bit of a confliction sometimes, a lot of the time.
Yeah, and that's why it's really important to work with the coaches, and the coaches be open to working with the physio and or whoever it is. That's why I really like Tom, because he's great at getting in contact, and we have this conversation, and we really get to the bones of what this client needs to recover. But sometimes there's nothing either of us can do. We just have to wait. Like, sometimes time is the biggest healer, taking time away from that kind of area of the body, focusing on other things. But we're all our own worst enemy with that, aren't we? We all just kind of, I would sometimes say to clients, do as I say, not as I do, because I'm terrible for taking recovery and not overdoing it and picking up little niggles, but I don't want that for them,
Is there anything myself, Ryan, and other coaches can do to, I suppose, help the clients, like help us spot maybe when they need to come and see someone like yourself, rather than just trying to do it yourself?
Yeah, I think you can see it straight away with someone's posture a lot of the time, especially like I said with that shoulder, that capsular pattern, because you'll see this shoulder here and then this one's here, and then almost like, as well as if you're doing check-in photos with your weekly check-ins, you see in their posture kind of weekly, and you can see either changes going in the right direction or wrong direction, and it's having a bit of understanding, I guess, of how the muscles should operate and where you should be to, if that's good. Because like you say, with the tendons and pains and things, potentially if you say we're doing the lat, it's going to bring you into that position initially, and it's probably not going to feel too painful, but as you keep training, it's going to get worse and worse and worse until there's a point of like, okay, yeah, I need to change something. But if it's seen from a check-in initially, you're like, all right, okay, when we're doing lat movements, whatever we're doing, we'll just bring that intensity down, we'll work on tempo rather than weight, and we'll still get a quality workout in, and do it that way. Because I think when it's looked at rehab as well, it's taken, you're doing like band work, you're doing body boringness basically, but actually if you've got a solid program that you can feel like you've had a really good workout in, that's probably the better approach, or it is the better approach for rehab personally. The only limitation there is usually like gym, and again it's like 50-50 with people who go to the gym and don't go to the gym that I see. So
the issue as well is a lot of people, and I see it a lot with like tight lats and just very unfunctionable shoulders, and that'll affect their bench press, and they'll have a massive imbalance on one side, and it's not the fact they're particularly weak on that one side, it's just that they can't get their body into that kind of really outwardly extended position, and then this lat isn't engaging right, it's coming loose a little bit, throwing forwards, and that just creates all this lack of tension, lack of stability, and then lack of strength. So one tight muscle can have a huge impact down that one side when it comes to other muscles and other exercises. That's a big thing. I have a toolbox of ththings that we go to when there's like a tight lat. Right, can we get it looser? Can we start stretching it more? Can you do some things by yourself before we refer you?
100%.
And if that doesn't work, then obviously we get the kind of, the professionals, the guys that know what they're doing on board, like yourself.
Yeah, no, definitely. And I think that's the better approach to do it than, because ultimately it's quite painful to get a muscle to release off sometimes. So if you can do it without getting elbows in or
and sometimes for a lot of people it is just a small amount of stretching. Like we do a lot of like hanging from bars, and we do like single arm hangs. There's a little playbook I have of things that we go to, and like I said, sometimes that works, sometimes it doesn't, but it has to be addressed at some point, and you can see it getting worse over time if it doesn't, from the checking photos, from the way they're performing exercises. That imbalance on the bench press, one side's right up here and one's struggling down here. We see it all the time, and there's clearly something not quite right, and it needs to be addressed. And I also think that's where experience comes in as a coach. Like you can't really... That's one of the best things you're paying for when you get a coach, is experience, someone who actually isn't going to fuck you up even more, because that is such a big issue in our industry, isn't it? With new coaches, and we were all new at some point, but you have to know your limitations, for sure.
I'm thrilled that you've said that, because I wrote something down then which is injury is opportunity, and that's a nice little reframe, probably something that you do yourself, George. But if someone picks up an injury, it's an opportunity to learn, to work on other weaknesses, to pick minds like yours. I imagine every injury or any setback that someone has who comes to see you, do you find that every single session that you're always like, actually this injury is an opportunity, it's an opportunity for me to help them, but also to learn and add strings to your bow?
No, definitely. It's a case of what I like to do is teach them why their injury's happening and actually how they can prevent it. So if it comes again and for whatever reason they're like, that niggle's come back in, they're like, right, I don't need to go see the other one. I know the steps I need to take to get it there. And then obviously if they're struggling, they can come see someone. But I ultimately want them to learn as much information about their body to understand, because I think that's one thing that people just don't understand their own body, which is crazy, because it's our own, everyone's got one, and just no one understands. And it's funny sometimes because I'll be like, oh, so the quad, and then someone's like, the what? And I'm like, oh, sorry, your thigh, your thigh. And just like
every session.
And obviously to me it's language that I think is simple, but it's still not simple enough. I think them gaining that understanding of their body, and it's often at the end of the session they're like, oh, session was great, but actually the information you give me is loads, and I tend to blurt too much at them sometimes, and I'm like, oh, just message me afterwards if you've still got questions, because I've thrown so much at you.
You get that glazed look in their eye. It's like that meme where there's like numbers and equations going around the head.
Because you know the body so well. This is a really nerdy question, by the way. Have you got a favourite muscle name or favourite part of the body name? Because I have some, I'll be honest. I love saying it. I think it's just from my nerdy, I love words, I love the body. Two ones for me, mate. Sternocleidomastoid, I like that one. That sounds like some sort of dinosaur.
What the hell is that?
Sternocleidomastoid, big muscle front of the neck.
This bad boy.
Okay.
And the other one is the thoracolumbar fascia, which I've said on the podcast before. Oh man, I love it. Is there any ones like that for you?
This is going to sound really childish, but so you've got your erectors in the back, and it's not even like a thing. But I just find it funny when I say erectors, and inside I'm like giggling, and then and you get a smile off some people, and I'm like, yeah, like that. That's funny. But again for me, the erectors I like because it goes down that whole spine. If you can get some good releases off there, people feel so much better from like forwards, backwards, side to side. That I don't know. They're just my inner child makes me laugh when I say erectors.
The stand up and the more erect is what you're saying.
But my inner child now is going to ask a question. And do you ever get any issues that are like a little bit more, let's say, personal, like in personal places, where there's like some groin issues, or they're into like certain areas like genitals and stuff like that, or like that area where you're like there's a real issue and I know where it is, but I just probably can't go around touching there.
Yeah, so like adductors, I find it's quite hard. So, and I've done it before, and it didn't go down particularly well. So I'll use dry cups, and I was like, right, well, I don't really want to be touching like that far into the groin and adductors, like inside the leg. So I've used some dry cups on there, but obviously, like it sucks the tissue in, and then this woman was just like, feels like I've got a penis. I was like, yeah, that wasn't the intention I wanted. I was just trying to not touch that area, and so kind of around there, and it's often like when people are. I found it a lot actually. People from doing like the leg press machine, for whatever reason, they'll use their adductors a lot on that last little bit, and they'll strain themselves in some shape or form into there.
Okay. As someone who's had adductor issues in the past, it's horrible. It is grim because you don't necessarily want to go to a massage therapist and be like, my groin's knackered. What am I going to do there?
And you can feel it. So there's like 3 muscles that sit through there, and if you've got that separation, you can feel it. It feels really nice. But when they're not playing ball, it's just like a solid lump in there. And they all just react.
Do you mind telling us a little bit more about cupping? Because I feel like that's a very viral thing where sometimes you can see, I don't know if you've seen the viral video of a guy with like hundreds of cups on his back, and it's mental. Like, what's the purpose of those and what are they?
So when you put the cups on, it decompresses the tissue. So effectively, you have your skin, you have myofascia, which is connective tissue, then you have your muscle. So when you're putting the cup on, you basically want to decompress that connective tissue in the skin. It might go into the muscle a little bit, but that's not what we're after here. You're after kind of decompressing that connective tissue, because what sits in there are like toxins, lactic acid, and you want to flush that through. And because sometimes what can happen with that connective tissue as well is it like pulls nerve endings in. And that's why it can be really painful sometimes. So you leave that on. You can either do like active movements with it, which is super cool and gets a lot of relief, or you just leave them on, take them off. And it's crazy how you'll touch an area and it's like maybe like a 7 out of 10 pain with them. You put the cups on, take them off after like 5 minutes, and they're like, oh, it feels fine.
I can totally relate to that. I've had cups before where they've gone in with like the fingers, and I'm like, whoa, and I've like winced a little bit, and they put the cups on, gone back in 2 minutes later, and I'm like, wow, that feels so much better. The way I got it described was it's a bit like a massage from the inside, because you can push a muscle in, but you can't push the muscle back out. And cups help with that. So it basically sucks it out, and almost like you're pushing from the inside out. So you get this kind of funny thing where you pulling it out to start with, and then you can push it in. So which makes total sense.
I've seen them misused a lot, which is really bad. So people just put them on like full suction, and then what happens is these marks stay for like months. They're really bad. I've got one guy at the moment. He went to see someone like 9 weeks ago, and I saw him on Saturday, and they're still there, and he's just like, I'm mortified. So
you shouldn't get to that point though, I don't think, with them. You shouldn't get to the point where they're bleeding and the cup's full of blood. Like,
no, it's literally like a few goes, and that should be it.
Have you heard people do DIY ones? Is that can you just buy them off Amazon or?
I've not. I think it might have been social media that I saw a horror story, and basically what happened was they used a glass, they put some heat in it, and then they put it on. However, they made it too hot, and then it got stuck, and they couldn't get it off.
Oh shit!
And the mark on it was horrendous.
Wow! Got it stuck.
Yeah, it just got stuck.
Oh wow!
You have to like wait for it to kind of cool down, and then you can take it off a bit easier.
Jesus!
Don't try that at home. That's pretty grim.
So even though these like tools are super safe, it's like you can misuse them.
Because the fact that anyone can buy them,
that's it. You just go on Amazon, like 40 quid, it's like sound.
And you said about like tacking a muscle down and then getting some active motion in there. That's the weirdest thing I've ever experienced. Like when you did that to me, I was like, what on earth is this feeling? It was like my body were like detached. I'm like, why is my arm moving like this? It was so weird.
Because it just keeps that in place, and then everything moves around it. It's surreal.
It is wild.
It's cool.
A quick question for me about pain, because I've heard this from like people I've spoke to in the past in a similar world to you, where they've said you can either go with me or you can fight against me. It's up to you. You can either let go and release, or you can hold on to that. How vital is that people just give into the discomfort, if that makes sense?
So depending on how painful it is, like my sessions, I like to just chat to someone. However, when they're in loads of pain, it's just loads of breath work. So the main thing for me, there's loads of different breathing techniques, but as long as you're breathing in, like say 4 seconds, but that exhale is longer than your inhale, like you're doing breathing correctly. The cue I like, which has worked for everyone, and I don't know why, but I'm just like, imagine you're sinking into the bed, really relaxing down, and for whatever reason that stops that person from fighting me. Because sometimes I've had some fist fights with people who are like, they just won't let go. I'm like, just relax. But no, yeah, when they breathe, like it just desensitize that nervous system, and just it really helps.
Same thing in our coaching sessions. Like I see it all the time where people, I know they can get low in a squat, but they're so tense and they're so stiff and rigid as they're going out to the squat. I just say, relax, loosen. Imagine you're going to go. Imagine you're like a kid and you're going to go and pick something off the floor. Don't worry about, because they're trying to probably keep their back straight, and that's tightening everything up around here. For me, I actually don't mind if it's just a body weight squat, them sacrificing a little bit around this and that spine just to get them low, because it gets that body used to that full range of motion. And that probably just strikes up another question, actually. Like, a lot of these issues are down to lack of range of motion, right? People do things for a very small range of motion, work a very small specific area of a muscle, and it creates weakness. Range of motion is massive for creating strength in a muscle, as we know. And I think that it just overloads tendons and causes other issues, because let's say for a bicep curl, they're only ever going to 90 degrees, they never kind of straighten that arm fully out. You're missing so much of the muscle that you're working, and that just puts strain on these very particular areas of maybe your upper bicep, upper tendons. Is that something you see a lot of, with that kind of ranges of motion and people just not being able to complete things properly?
So it's more from a postural standpoint. So I'll find someone comes in and they've been training for however long, but when their starting point, their posture is in an awful spot. So then when they've trained in this bad posture, and they've almost like strengthened that bad posture. And then that's what's caused a lot of issues in their pain. So like you say, inadvertently they've done half reps or limited reps, and they don't know why, and because they just don't understand what's happening, and I find that's often they've had an online coach that probably hasn't like seen them in person, or they've just like gone on their own. I've found when people have seen people in person, them injuries don't tend to be there. So again, I think it's an experience thing.
That's fascinating. We might have to clip that up for the opener.
I feel like a lot of online coaches can learn from that. Like, I feel like we've got a bit of beef at the minute, haven't we? Like the Wild West of unregulated.
It's funny because half my business is online coaching, so I can't say too many bad things around it, but you have to find solutions to issues, and one of the things we've found is getting clients to take videos of their lifts and having what we call video analysis, and that's been a game changer. Actually, if someone's local as well, I really encourage them to come down, just free of charge. Let's have a look at your main compound lifts, the things you're struggling with. Let's have you doing them right. And there's one guy recently who wasn't too far away. He was only in Manchester, and he came over and he had a session here, and he was like, "I've never ever been coached like this. I've never had this level of coaching." He'd never had he had other online coaches before. But I think it's so important that someone, because people are going to be doing these every week in the gym, and for them to do it wrong and in the wrong way is only going to lead to disaster. It really is for a lot of people.
Massively. And good or bad for like the physio injuries, therapist injury, I think a lot of it is end up going to go online in some shape or form. So obviously big online push for PTs at the moment, but I actually think physio is going to go that way. And that's the way I want to go a little bit myself. But I want to keep that in-person thing, because like I say, I want to work on posture as I can see, / like working on that hinge movement, that squat movement, make sure that them fundamentals are good, and I'm like, right, you can go on your way now. We'll still keep a close touch, but I'm happy that I know you're going to rehab yourself in a correct way.
I can see why physio would work, but you can't replicate that hands-on approach of actually giving someone some dry needling, cupping, sports massage.
I feel like, just to echo that, practice doesn't make perfect. Perfect practice makes perfect. And if there is any online coaches listening who doesn't do any video analysis, please go and do it. Like, please be very, very aware of how people are moving. Don't just take the word for stuff about how, I did 100 kilo on my squat today. Yeah, but did you? To what standard? What did it look like? What did it feel like? And I just think too many get caught up on the numbers.
We do. We celebrate numbers rather than form. And I say, when a client can do a perfect squat with great depth and it works the right muscles, that should be celebrated as much as a PB in my eyes. And I really try and draw attention to that. So but I think that also knowing your limitations as well, getting the right people on board, like yourself. I think too many, and maybe I fell victim to this a little bit in the early stages of my coaching career, where you feel like you can solve every issue for every client. And maybe there's a bit of young naivety in there as well. but you also have to be able to put your hands up and say, no, I think you need someone else here. And do you know what I think a lot of my issue with that was when I was younger? I was worried that they were going to not be able to afford it, or I was going to be asking too much of them. You'd be surprised when it's someone's health and fitness, and when it's really going to solve a lot of issues for them, how much people are willing to be like, no, you know what, whatever it costs, as long as it's not crazy, I'm happy to go and see some people. So don't be hesitant of that.
Yeah, no, and I think that's the good thing, like creating a network 100%, even if it's like myself, like you're a physio or a massage, but you've got a good PT that you're like, right, okay, like I've give you this plan, but go to this PT and they can go with it through you. Because if it's a bit like myself, like I haven't got enough hours in the day to start coaching people like in person as well as what I'm doing. I'd just be working all the time. So actually being able to offload, right, okay, so this is what you need to do. Like go do it with this person. Like they're amazing. They know what they're doing is huge.
You mentioned about the future of physios, maybe a little more online.
Yeah.
How do you see that looking, whether it's from your thoughts on it, like the aftercare you could provide, or what's your thoughts with that?
So I think with the online stuff, it's a case of, it will be a kind of a more selective group. So say it's your gym goer, you're more like, I guess, someone that's into their physical well-being. You can get away with the online sort of like consultations. So from chatting to someone, you can have a really good idea of what's happening. And from there, and even with like the postural stuff that I was saying, if I know what, I can look at their posture and be like, right, you need your lats sorting out. They can just go to someone that's kind of local to them, get the lats sorted out. And then I'm like, right, okay, yeah, I'm happy with what sort of state you're in. Right, let's continue this way forward. So I think by maximising time that way, people can get a lot more out of it. When it comes to chronic pain and stuff,
you'd also have a network of people across the country who, you were kind of almost referring people to potentially. I know this person, go and see him, they're great, they'll sort those lats out, come back to me in 2 weeks.
I think that's a better way of having it, because...
Or even having an app where that's on a database where physios sign up and they can search on this app for people in the local area, and you can get reviews and ratings. We just thought of a new business idea.
That's a common thing for us now, which, Ryan uses this expression a lot about being a North Star. That sounds like an amazing place to be like, you've not got all this noise coming in. You've got one person who's going to do consultation, look at you and be like, cool, you might need some hands-on stuff here, but here's how I can guide you for doing that. Like, what an amazing way.
I can see it going that way. I think with how everything's so online, it just makes sense. It's going to go in that way somehow. That's how I envisioned it anyway.
Let's swing it back to dad chat. How's obviously you've got an 18-month-old. 18 is it?
18, 19.
19-month-old.
Yeah.
How's that impacted everything that you do, from your business to your training? Like, has it thrown a spanner in the works like it does with most people?
So training, I was amazing, super consistent up to about 8 months ago. And then business went crazy, wanted to spend more time at home. Training has just dropped off 100%, which, to be fair, Kate, my girlfriend, she is getting back into fitness a little bit now as well. So I think that's going to push me further to better myself that way.
What kind of training do you do?
So weight training specifically, however, like seeing the high rock stuff, I don't want to be a high roxer as such.
Not ready to walk your kid off yet. Not ready, run around and chat with yourself off. Wear the headbands.
Maybe next year.
Plastered on tattoos.
But I'd like to get into that sort of, what I said, like longevity, functional sort of more fitness. Like initially, when I was younger, I just wanted to be massive. Now I've come to the conclusion that my genetics aren't the greatest for that. Like my body just doesn't want to hold on to much size. I have to be super strict, and I just don't want to do that as a lifestyle.
I told you, mate, damn Norwegian genetics.
Are you both of Norwegian descent?
I feel like we are.
Yeah, maybe.
I can't help but feel I've done all the ancestry stuff.
Or Danish. I can imagine you being Danish, actually.
Have you done the ancestry stuff?
I haven't.
It's awesome, man. Like it showed me like a specific region of Norway where a big part of my DNA comes from.
Oh, really?
No way.
Yeah, it's really cool.
I did it.
Yeah.
And I was Lancashire. Just like thousands and thousands of generations of Lancashire. I was like, great.
Just a minor.
Commoner.
Yeah.
Lower class. But yeah, it is. I mean, becoming a dad just puts like a real twist and everything. And but you've done pretty well. I mean, to hold out for that first year or so, still training, still staying in the routine. I mean, I used to see you in the gym. I probably don't see you as much in the gym. Whether you train different times, I'm not sure.
That's it. Yeah.
Have you noticed your sense of humour's got noticeably worse since you become a dad? Because day one of me having a son, my sense of humour went down the
I
pan.
feel like Brad was looking for an excuse to for the dad jokes. And Ted gave him that excuse.
Gone down the pan, mate,
that's
honestly.
it. Yeah. I think I find myself funnier than most.
I agree, mate.
But no, it's been great, and sort of like business wise with being a dad. When finishing like uni with the physio stuff, I had the option of going NHS, working like 9 to 5, probably not seeing Arthur through the week and seeing him on weekends. And I was like, I don't want to do that. So I was like, right, let's go full self-employed. Let's work hard while I was at uni. So kind of set myself up. And then last year was like, right, let's go fully self-employed with everything. And that's kind of what spurred me to TikTok, really. I was like, that pressure. I was like, right, I need to get clients through the door here. What am I going to do? I don't want to spend loads of money. I just want people to see me and see what I do, and that's kind of what pushed me to social media, and I think that's why I stay consistent with it. And then I basically built my business about being at home, really. So I weekends wise, I only work every other Saturday morning, so I just do like 4 hours, so twice a month, and then on a Monday kind of get mornings, Tuesday afternoons, get time there. Our busy days are like Wednesday to Friday. However, we just dropped Arthur out of nursery on a Friday, so I get a full day with him there.
Cool.
Like we were spending an absolute fortune on nursery fees. I was just like, I'll just have the day off. Like,
I'll just work it into my routine.
So when I have my long days, like they're long, and Brad probably sees me like on the sofa like that. But as soon as I go into that room, I just like snap into it. It's fine. But it's the end of the day that I'm like, whoa.
It's physical, your job as well, isn't it?
Yeah.
And I'm really proud of you for that. I asked you before we started recording, did you do probably what me and you did, Ryan? Just get his head down and graft for weeks and months, and then be like, oh shit, we probably need a bit of time scheduled off here.
Yeah.
So I'm proud of you for just saying like, no, I want to do this, because you don't get those years back, do you?
That's it. And everyone said to me like, they're like, wow, that's class, like you've done that. Like as soon as you get to school age, it like totally changes. So yeah, he's potentially due to go back to nursery on a Friday in September, but we'll see what comes in September. See how busy I am. And
some of my favourite moments in the week are just that scheduled timing with Harlow, where it's just you and her, and you can do whatever you want. You can go to the park, you can go to the play centre, you can I get downstairs in the gym. You might have seen a few videos of us deadlifting, but I think it's you're never going to get that time back. So as crazy as work is right now, you have to sometimes snap out of it and say, right, I don't look back in 10 years' time and go, oh, I wish I'd made the most of when she was a toddler.
Yeah, and with busyness as well, I've capped myself now, and I plan to stay at that. I don't want to go any higher, just because I want to spend that time, just because I know it's so precious, which is weird, because I think if even 4 years ago you said that to me, I'd be like, yeah, whatever. That's not me. But yeah, things would just change massively, which is nice.
The moment that baby's born, your whole mindset changes, isn't it? Every priority, everything. You walk out that hospital and you realise that, oh shit, like we have a life that depends on us now, and your own time and how much you give to them is currency. It's their own currency. So it was a surreal experience for me, because I think they talk about it, but like the mother to child bond is super strong, and then as a dad you're kind of just there, I feel, and that you're obviously trying to provide and do as much as you can, but you don't really get much back from your baby, and you're like, you feel a bit odd and out of place. However, once you start to get that like a bit of interaction, that's what makes it like super special. It's funny, it probably was around 18 months where I felt like that as well, because I felt like a proper spare part. Like first 18 months, she just wants, mum feeds her, she don't want, I'll pick her up and she's crying until mum holds her. Like it was, you really feel like, I'm not part of this. It's easy to feel pushed out a little bit. Then it probably was around 18 months when you can take her for a walk and you can hold her, and she's responding to you a little bit more. And especially when we started getting her like in the gym, lifting some weights, it was our little kind of bonding time. I know it sounds quite young, but it was just lifting a 4 kg kettlebell, grabbing and doing that, and it was that was such a nice moment, and it's only got better from there. For sure.
And speaking of interaction, like wait until they're 4, going on 5. Like Ted's like my shadow. He wants to be like me, do everything that I do, and it probably forces you to like reflect and be like, are my actions actually good?
Are they worth copying?
Are they worth copying? It's such I think especially with a son as well. Are you aware of any actions of yours that you're like, oh, I'd love him to get that trait, or avoid this trait if you can, Arthur?
I'm not sure about traits as of yet, but the one thing that I've noticed that I do, and he's picking up on it now, is I'm so bad for snacking, and I've got like snacks, and he's like, snack more, and I'm like, no, I know, that's almost sort of high away from him. But so I'm really bad for snacking and like, but bad snacks. Whereas he's amazing. He eats fruit and everything. I need to be more like him, really. And yeah. Like little habits like that, I've noticed myself more because I'm like, oh well, I can't just get this anymore because he'll want it, and I don't want him to kind of be eating this all the time.
Do you see any issues when it comes to parents and like the obviously services you provide? So
yeah,
I think back to probably when Holly was around like a year to 18 months, when you'd have to take her out the crib and rock her for like an hour on end just before she fell back to sleep.
Yeah.
My back would be in pieces, and I'd go and try and deadlift it after, and I'm like, just from holding it for like maybe even half an hour sometimes, I was so much more weak. Do you find there's specific areas that get tight for parents and things that kind of flare up, and any potential ways they can get around that?
I found it really interesting with women actually, like post pregnancy, because obviously body's changing, hips have kind of got wider and everything has had different strains on it, and then like you say, all the time they have usually a favoured side where they hold the baby for a long period of time, and like say, get them back issues, get arm issues. I've seen lots of tendon issues in the arm itself.
I'm convinced my bicep vein here is purely because of since I didn't have that 2 years ago. I'll tell you now. Just from holding it after training biceps for the day before, and having to hold it for half an hour with your hands. Best workout of your life, that.
And kind of prevention for that. It's really difficult to do. It's probably a near impossible task because you can't not hold your child.
Of course.
And switching and things like that. With regards to kind of the sports massage stuff, I that's where I have probably seen benefit, because you are releasing off that muscle, you're releasing off that tension, and you put them into a better state. Don't get me wrong, it's gonna come back. And that's probably where a semi more regular massage is probably appropriate and things like that, just because you can't get away from them certain patterns. It's not like, all right, if you don't hold your child for 4 hours and do this exercise, you're going to be better. Like it's just not going to happen. So I guess in that respect, like that would be appropriate for me if someone was like, right, I've got this, like, okay, let's do it a little bit more regular than we probably normally would.
Aside from the sports massage, anything they can do at home, do you reckon, to like release some of that tension? Any specific stretches, any movements around the house?
Quite like the foam roller. Not in the respect of a lot of people you see in these videos where people are rolling up and down themselves, like causing themselves absolute agony. Like if you've got like sore spots, just laying on that foam roller, like breathing in and out, it gets that release, and really kind of helps your, especially if you've got like smaller spots. You can even use something smaller, like a massage ball, tennis ball,
trigger point,
just to get into them spots. And I found stuff like that really helps, and I use it actually as a, what's the word, like after a session to keep people in a good spot with how they're feeling and things.
I'm glad you mentioned those. They're two of my favourite bits of kit. And again, coming back to like if we've got a playbook of things that people can use before we send them to someone with a sports massage, my 3 pieces of kit are obviously the foam roller, trigger point ball, and I also have this like, it's almost like a rolling pin with rollers. If you see that, it's got 2 handles. That's really good for like calves and going over some areas of the quads and stuff. So I really like those things just as a prerequisite to sending clients to someone like yourself.
Do you ever get any common questions that you want to address to the masses now? Because I'm a big believer of, if you repeat it, record it. Because it's quite a nice way to be like, this is complex and I could explain it to you, or I could just send them this link and be like, check this out.
With common questions, honestly, everyone's kind of different. Usually the question I get, which I'm not going to be able to give a generalised answer to, but it's like, what else can I do to help that out? And obviously everyone's different and specific. It is, like you say, doing the things outside of that. And even if it's a couple of minutes a day of just like a little bit of foam rolling, get in there, make some pains out, doing that goes such a long way. Just like chipping away at it, doing that approach rather than, right, I'm going to do an hour worth of exercise today and that's going to make it better. Like that's not the approach. It's just chipping away at it and being super, super consistent.
Stretching for me. I just don't think enough people stretch. That can relieve so much tension over time. And from tendons to muscles. It was such a big issue early on when I first started coaching, I developed this like 3-week stretch and mobility program that I was like, just do this for the next 3 weeks, and everything will move better. You will feel 10 times better. And even just stretching, it's amazing how people, like, from a weight loss point of view, burn calories stretching. Some people will do like 10, 15 minutes of stretching and they're sweating. They really are, because it's that intense and that hard. And there's that much tension being put on the body.
I definitely find with stretching, it's a case of, if you're just isolating one muscle and stretching, it's probably not going to be that beneficial for you long term. But if you're doing more like mobility stuff where you're getting the joint involved, you're using more muscles around that area, that's definitely a plus. Like that's good to do.
For sure.
One thing I really love about George's approach is, I feel like I'm picking up on this word now, empowerment, that has been, I'm going to say it's been pinned to like the female community about like, oh, empower yourself as a woman and all that. But actually, you can spread that across anything. And for you, empowering people with information and critical thinking, you're not just a service provider. You're not just like, oh, come in, I'll sort you out, I'll get my elbows in there, and then you're on your way. You're actually trying to pass it plate forward a bit.
And that's as a business. When I first started, it was an awful model, because I would get people in and I'm fixing them, and then they're not coming back, and I'm like, got bills to pay here, like panicking. But word spreads quite quickly, and when you provide a good service, like, you do get a lot of recommendations, which is nice.
It's the kind of ethos for the health and fitness industry. If you're good at what you do, eventually, they're going to go off and be able to do it by themselves. But I think that's where longevity in the industry really helps out, because there's going to be those referrals. The amount of return customers we get is great, because they want to try new things and reach new goals, and repeat business for you is good as well.
You can all celebrate them as like a graduate. I know you've spoke quite at length about one of your clients.
She's got an Instagram page called the R5 Graduate, which I thought was awesome. But she's been here a couple of times, and most recent time she came back postnatal. And she was like, I really want to like just continue this journey of like posting and celebrating what I do. So she's at this Instagram. It's really cool actually. She goes into great detail about kind of being a mum and planning it around. And she's got a crazy job, one of these jobs where she works like 3-4 days in the week, but they're all like 12-hour shifts, NHS worker. And God knows how she does that. I haven't noticed. One of those people, you look into their lives and they tell you all the intricate ins and outs. And I'm like, I just don't know what to recommend here. Why are you not sleeping all the time? It was that stressful and crazy for her. But some mums out there, they just if they want to do it, they'll find a way. And she's one of those women who finds a way.
No, that's amazing. That's cool.
It is amazing. And look, you can graduate numerous times. You can go into different disciplines. You can go into different modules and that sort of stuff. So I love that comparison. So credit to your client, whoever that's Kate. Amazing.
Kate Connolly. Go on, Kate. She won't be against me mentioning this. She's a good girl.
That's fair. Love that. Have you got any final questions for George?
No, I think that's it. I think just obviously where they can find you online, and where you want to direct people if they want to get in touch with you.
So I guess TikTok's okay. It's like geotherapy, but Instagram's the one where I'll probably be able to reply a lot more, and that's geotherapy and then 1 at the end. Like I say, with regards to the hands-on, that's definitely the thing that I'm good at. I'm trying to phase into a little bit more of the online rehab, but only when it's appropriate for people, and that's something that I'm trialing out at the moment. So I'm planning to kind of put a bit of a group together soon, where I just kind of trial things through, see how it works and the efficiency of that. So that's my next step with kind of business, just because I'm so limited with hours that I want to be able to give as much as I can.
If someone's interested in maybe being a part of that group, happy them just messaging you saying, count me in. Or
I, to be fair, prior to this, I've set up a Google Forms. So there's like a little questionnaire. You can just put name, details in, and then I can get in contact and just have a phone call or message or whatever works if someone's interested.
Awesome. George, thank you for today.
Thank you.
Thank you,
man.
Thank you, mate.
Guys, thank you for joining us on the Fit Dance Podcast. We'll see you next one.
See you soon.
Bye.
Cheers, mate.
Enjoy it.
Thanks so much.
It's good.